Record sendiri. Right. Okay, Assalamualaikum and a very good evening to all. Welcome to webinar series 2/3 organized by the Center of Sustainable Campus and Energy Management COSEM. Right, so the theme for the webinar is on impact of the COVID-19 pandemic on the environment, UniMAP perspective and initiatives. So welcome to all attendees, either you're hearing it online on Google Meet or online on Facebook Live. So I am Dr. Umi, will be your moderator today. So generally we have, last week, we have discussed on the impact on water and energy management, which were really informative by Dr. Haki and Mr. Tengku Izhar. So this week, it is a privilege that we have two panels with us to discuss on the impact of the current pandemic on solid waste and air quality management. So up till now, the total case worldwide is at 33.8 million cases of COVID-19 with 1.1 million of death recorded. Thus, the COVID-19 pandemic will leave a lasting impact on nearly every aspect of our life in society and has also raised concern on the contamination risk associated with the environment, including waste and air quality management. So we in COSEM have this webinar where we shall discuss the impact with our two panels today. Our two panels is Dr. Tengku Nuraiti and Dr. Sara Yasina. So I will introduce them later. Within this webinar, we will have the two panels presenting. We will start with Dr. Tengku Nuraiti, who will present on the waste management, solid waste management. And secondly, we will open for, we will move on to the presentation by our second panel, Dr. Sara Yasina. She will talk on air quality management. And at the end of this, at the end of those two panels presentation, we will open for a question and answer session. So basically, you can always drop your question in the message next to the Google Meet, as well as you can ask the question live, and you can always ask the question in our FB Live, UniMAP FB Live as well, yeah? So first and foremost, I will start to introduce our first panel. So Dr. Tengku Nuraiti, Tengku Izhar will talk on solid waste management. Dr. Tengku Nuraiti is a senior lecturer graduated from University Science Malaysia. Now she serves Environmental Engineering Program, okay, under Faculty of Civil Engineering Technology. So her field of interest is environmental engineering, mainly on solid waste management and sustainability. She is currently the main team members of collaboration between UniMAP and E-Idaman on developing research laboratory on sustainable waste management. So Dr. Tengku, are you on the line? Right.
Yes, Dr. Umi.
Tengku, welcome to
Yeah,
the
thank
webinar
you.
series. Okay, perhaps you can share your presentation.
Okay.
Okay, there is, we will approve the attendance of students. Okay, so, right, Dr. Tengku, yes, yeah, so very clear here. So might be possible if you can start your presentation. We welcome Dr. Tengku Nuraiti, Tengku Izhar to present on solid waste management.
Okay, thank you, Dr. Umi. So everybody can hear me clearly?
Yes, loud and clear.
All right, okay, thank you. All right, okay. So today this is the second webinar series organized by COSAM. So the next topic which I'll be presenting today is on the solid waste management. So on the topic is on the managing growth in the pandemic solid waste. And I am Tengku Nuraiti, Tengku Izhar. I am a senior lecturer at Faculty of Civil Engineering Technology, UniMAP. And I teach on solid waste and hazardous waste management and engineering to the environmental engineering student. So before I start, I would like to clarify that this presentation focus on municipal solid waste, mainly on household or domestic waste. I will not discuss on the clinical and also hazardous waste. So I will start the presentation with the impact of the COVID-19 pandemic on the waste sector. And according to the Waste Management Association of Malaysia, waste generation in residential areas has increased by 20 to 30% since the implementation of the Movement Control MCO in March 18 until June 2020. It is another damaging consequence of the COVID-19 pandemic. It is the massive amount of solid waste generated by people as they seek to protect themselves from being infected by purchasing and using personal protective equipment, PPE, such as gloves and face masks. And during this period, they're also managing their food and other daily needs while under lockdown. People lock up in their homes and went online to shop for food and other personal needs. These activities necessitate the use of huge amount of packaging, particularly single-use plastic bags, and also containers. Use of face masks and gloves, and people also use sanitizers, usually stored in a small plastic bottles, will also contribute to single-use plastic generation. During this period also, some stores do not allow customers to use their own shopping bags and food containers in fear of contamination. And this also will further increasing the usage of single-use plastic bags. For PPE, while there are standard operating procedures for disposal for use PPE for clinical waste, that is not the rest of the population. Usually, these items will simply be thrown into the dustbin along with our household or domestic waste that will end up in landfills and remain there for a very long time. Some of the face masks and sanitizer bottles are end up in the rivers, most likely from public and also from the commercial premises. So if we are not careful, the new normal of staying alive can result in a totally unmanageable level of waste generation. However, with the increase of household waste, it is evened out by the decrease in commercial, industrial, and institutional waste, because this sector, which is factories, businesses, offices, commercial premises, universities, and schools, have had to close during the MCO period. So the overall increase in household waste hasn't surpassed the waste generated by other sectors. And some landfill operators have also revealed that the amount of waste entering their landfill has dropped around 10 to 30% per day since the MCO was implemented. However, the volume of medical waste has increased up to 40%, and hazardous waste production has grown with higher production from the pharmaceutical and also from the medical sectors. Another impacts of pandemics is the safety of the solid waste workers. During this crisis, it is highlighted the unsafe conditions that the solid waste workers work under. So therefore, the solid waste operator and workers, they are provided with appropriate PPE, which according to their duties, whether they are work at the collection section, transportation, or at the final disposals. They were equipped with masks, overall gowns, caps, gloves, and boots. Malaysia managing the solid waste by sustainable solid waste management. Sustainable solid waste management is the government's strategic goal to provide integrated, cost-effective solid waste management, at the same time reducing the adverse effects on the ecosystem progressively, as well as to meet the needs and the quality of life of the community. So according to the traditional waste hierarchy, most of the waste are disposed or sent off to landfill, while the least desirable method according to traditional waste hierarchy is reduce, reuse, and recycle. So with the new management paradigm, we need to focus on the reduce of the waste, which is the waste prevention. And this can be achieved by the product design, and also the producer takes responsibility to produce or reduce the waste generation, followed by reuse and recycle. The least desirable method, according to the new or the most desirable, is landfill. Shows that the least waste, solid waste, to send to landfill. This flow shows the overall or generally a solid waste management in Malaysia. Okay, the generators usually is from household, commercial, institutional, trading, construction, industrial, or the public cleansing. Will need to segregate the solid waste at the source. So generally in Malaysia, whether it is a federal or state management, we need to do the segregation at source. So from these activities, the waste will be divided or categorized into three types, which is the organic waste, the recyclable material, and the non-recyclable materials for collection. For the organic waste, it will send to biogas production facilities and also send for composting. While for recyclable material, it will be sent to a segregation center for recycling, where we need to recycle as much as possible plastic, paper, and glasses. However, there is another category, which is the non-recyclable materials. Usually, these categories include the recyclable materials that have been contaminated, therefore they cannot be recycled. So this type of waste will send to waste to an GWTE or end up in the landfill. From this flow, we can see that ultimately the waste in Malaysia will be end up in landfill. Two acts or legislation on solid waste management and public cleansing. I will introduce two acts just briefly. Okay, Act 672, Solid Waste and Public Cleansing Management Act 2007, which was gazetted on 30th August 2007. This act was introduced to aim of standardizing solid waste services and management, and also for public cleansing. The act empowers executive solid waste management and public cleansing cooperation from local authorities in Peninsular Malaysia, which also include federal territories of Putrajaya and Labuan. This act came into force on the 1st September 2011, and it was implemented in stages. Another act is Act 673, which is the Solid Waste Public Cleansing Management Corporation Act 2007. This act realized the existence of a solid waste management and public cleansing corporation, which is the SW Corp. So according to SW Corp, there are 7 categories or 7 controlled solid waste that can be managed by SW Corp. First is the household solid waste, construction solid waste, industrial solid waste, commercial solid waste, institutional solid waste, import solid waste and also municipal solid waste. 3 concession company that handle or collect or manage our waste is Alam Flora that manage the middle region of Peninsular Malaysia, while us in the northern region, Idaman Sdn Bhd, managing our waste, while the southern part of Peninsular Malaysia was handled by SWM Environment Sdn Bhd. So since 2017 and 2018, there are about 6 million tons of waste has been sent to landfill by this concession company. Just from this, we can already see that there is our ultimate or final disposal for solid waste in Malaysia is landfill. Other than landfills, final disposal facilities are incinerators, and also biological treatment facilities. There are around 18 sanitary landfill that still operating, and 128 non-sanitary landfill that still operating. So basic difference between sanitary and non-sanitary is sanitary landfill is an engineered or closed with a design landfill, complete with treatment. While for non-sanitary, it's basically just an open pit dumping area. So we still have 128 non-sanitary landfill in Malaysia. This data is until December 2018, according to the compendium produced by SWCOP. There are 4 incinerators and 4 transfer stations, and this incinerator mainly manage the clinical and hazardous waste in Malaysia. For organic solid waste treatment, composting, there is 9 facilities and around 5 anaerobic digesters that manage the solid waste. This data also until December 2018. I believe there is an additional anaerobic digester. Since 2019, there is a few more new anaerobic digester in Malaysia. Okay, let's skip this one. All right, okay, there is a question. Can business as usual work with respect to waste management during this pandemic? Okay, as compared to other countries in the world, for Malaysia, solid waste management run as usual. The workers and operators are part of the frontliners. They collect the domestic household as scheduled. However, some of the recycling centers has halted the operation. This figure shows the anticipated development of clinical and MSW, municipal solid waste, flow along with the pandemic crisis. Pre-COVID-19 waste treatment system that were designed for moderate variation could not operate abnormally due to dramatic changes in the quantum as well as quality of the waste. So from this figure, we can see that during the pandemic, the MSW, the municipal solid waste, will decrease while there is a increase for the medical or clinical waste during pandemic. So what are the implications of lockdown to the pandemics on plastic waste generation? I choose 2 types of waste today, which is plastic and also food waste. For plastic waste generation, the substantial increase in plastic packaging. Online shopping for home delivery of commercial and essential products during lockdown has inspired a surge in demand for single-use plastic bags. And at the earlier stage of MCO, the paranoia has led to irrational stockpiling of food and other groceries with long shelf life will cause undesirable demand for packaged products. The widespread use of single-use plastic bags due to public health concerns in restoring and also disposing our face masks and gloves. Increase attributes to online shopping and for products such as disposable wipes, cleaning agents, hand sanitizers, disposable gloves, and also masks. These items have seen a surge during this pandemic period. The decrease in the production cost of the virgin plastics, which is resulted from the drop price of oil, will reduce the demand for the recycled plastic. So from this graph, we can see that packaging is the top composition from a plastic waste by segment, which is 44% is the packaging. Expected increasing trend in medical and packaging waste, and the demand for food delivery or grocery delivery has increased common plastics packaging, which like PP, LDPE, HDPE, PET, and PS. For example, we bought toothpaste, right? So I think about 50% of the total of the whole package is the actual toothpaste, while the remaining 40 to 60% is the packaging. So for toothpaste packaging, what can we do? We cannot recycle, so we throw them away. So this is the effects of the single-use plastics. Okay, I would like to share with you today the impact of plastic packaging or single-use plastic. We conduct LCA, a life cycle analysis on the plastic packaging, also as on the single-use plastic, which is also a single-use plastics. So from the implementation phase, we can see that the most relevant impact categories is on climate change, acidification, and also particulate. And the most relevant life cycle stages is during the manufacturing of the plastic films and also the ending life of treatments of the plastic films, while the effects of particulate matters, eutrophication, smoke formation, acidification, and climate change. This is also very interesting. The result of the LCA shows that the most desirable or relevant end-of-life treatments for packaging plastics is landfill compared to recycling, because the recycling activities will impact the particulate matters, eutrophication, smoke formation, acidification, and also climate change. And bear in mind, during these studies, the landfill we did not put into consideration the LFGs. However, from this result, we can see that recycling of single-use plastic or plastic packaging is the least desirable, while the most desirable or relevant, I'm not sure it's the perfect words is desirable, but I think it's relevant. End of life for single-use or plastic packaging is we throw them to landfill in order to reduce these impacts to the environment. But bear in mind, these packaging plastic sent to landfills, the 40% of the total package will send to landfill. It will stay there for years. Even though it is the most relevant, it will also give impacts to the environment. So it shows that even though there is three options, landfill, WTE, and recycling, for single-use plastic or packaging plastics, it will definitely affect our environment. Okay, the next one is the impact of COVID-19 on food supply chain and generation of food waste. Because of the announcements of the MCO, the household food waste will increase because of this panic buying. Disrupted of food waste chains can lead to wastage of food due to hoarding and improper storage. However, there is also a positive side of this pandemic. People start to adapt to the new lifestyle, where we see people start doing their own gardening. They plant their own food, and urban terrace gardening for those who live in the area with limited spaces. And also the online delivery has gained popularity. All right, okay. So this is a general composition for household solid waste in Malaysia. Because of the increment of 20 and 30% definitely will affect the trend of the household solid waste composition, which is comprises of food waste, plastics, and other materials. Right, okay, so this is already in September, going to October tomorrow. What can we do in terms of solid waste management? we need to improve our communication, our healthcare waste, the generation of solid waste dynamics. Can we continue our waste collection and recycling? We need to consider the workers' safety, waste pickers, and also adequate disposals. We need to prioritize and keep in mind during the pandemic the safe disposal of healthcare waste to avoid cross-contamination or further spread of virus, ensuring the continuation of waste collection and recycling, which is UniMAP took very seriously on this matter. Before the MCO, UniMAP under the COSAM already has program on the recycling activities. And once the announcement of when we come back to UniMAP, this program definitely and took place right away. So we need to improve, we need to increase the recycling activities. We have to make sure the safety of workers, identifying workers involved in waste collection and disposal sectors as a key workers, development of adequate disposal facilities, need to understand waste generation dynamic, integration of waste picker and making sure they are well equipped and not exposed to the virus-laden waste, a clear communication and awareness stressing the need of source segregation and reduction in waste generation. All right, to conclude, I think each of us has a crucial role to play in this time of crisis. For a start, awareness on proper waste disposal is very important. Please use face masks and gloves properly, or otherwise just stay at home. If you stay at home, you don't have the need to use more masks and gloves. You can bring your own bags and containers when grocery shoppings and buy only what you need. And by doing this, we are reducing the waste while breaking the transmission of the virus. But if we don't have any choice but to purchase heavily packaged goods, we could learn how to eco-brick, reuse the items to prolong their lifespan, or set up a recycling corner in our home to store recyclables items that can be dropped off at the nearest recycling center. I think that's all from me, Dr. Mi.
Thank you, Dr. Tengku, for
You're welcome.
Your insight, for your informative informations. Yes, I can agree with you. It's really crucial for us to do a proper disposal, especially during this pandemic. Okay, we use a lot of face masks, we use a lot of gloves, and etc. However, I can agree with you about shopping online, which increase the use of plastics, especially during the pandemic, during the lockdown. And especially during, when we order food, from GrabFood or Food Panda, you have lots of this kind of storage, food storage and plastic that you use. So basically, yes, I agree with you that you produce lots of solid waste during the MCO, right?
Sometimes we did unnecessary online shopping. Right?
Exactly. That one is apply for women, or men as well. Okay. To all of you, you can drop the questions in the chat on your left, as well as we will, from COSAM, we will provide you with e-certificate for your attendance. So all of you can fill in the Google form link in the chat section. And Dr. Tengku, thank you so much. But however, don't leave yet because we have a Q&A session after this.
Don't worry, I'm here. I will listen to Dr. Sara afterwards.
Okay, nice, great. Okay, thank you, Dr. Tengku. So now I shall introduce to second speaker, which will talk on air quality management. Yeah? So a little bit of biodata of Dr. Sara. So Dr. Sara is a senior lecturer with Faculty of Civil Engineering Technology, serving environmental engineering program as well. Her research interests are ambient and indoor air monitoring and control, as well as carbon footprint. So she is also an associate member of ICAME, okay, Institution of Chemical Engineers. And she will talk on the impact of COVID-19 on the air quality management. So Dr. Sara is live in Google Meet, isn't it, Dr. Sara? All right, Dr. Sara.
Yes, I'm here. Sorry.
Okay, all right, Dr. Sara. Okay, Dr.
My,
Sara,
my
you can.
laptop got hang.
All right. Okay, you can share your presentation, and I shall give the floor to all of you. So for everyone who want to ask any questions related to solid waste management as well as air quality, you can always drop the question in the chat sections, as well as you can ask in our FB Live. Huh? So Dr. Sara, the presentation is yours, please.
Okay, thank you very much, Dr. Umi. So this is me in case you're not recognizing me. Yeah, okay. All right. So I will share my presentation here. Dr. Umi, do you hear me clearly?
Yes,
Is
loud
it
and
clear?
clear.
All right.
Yes, loud
Okay.
and
All
clear.
right.
Yeah.
Okay. Thank you so much to our moderator, Associate Professor IR Dr. Umi Fazara. Assalamualaikum warahmatullahi wabarakatuh and very good afternoon to my colleague, the co-presenter just now, Dr. Tengku Nuraiti, and to all the listeners and participants. Thank you so much for tuning in to us. Okay, inshallah today I will share. I would rather call it a sharing session. So I will share some information on current issues, which is COVID-19 pandemic. What are the impacts of this pandemic towards air quality and air quality management, and as well as what is the impact of air quality itself towards COVID-19 pandemic. Okay, all right. I will later share on some initiative that has been taken by UniMAP in preserving the environment as well, and also maybe some advice to all of us regarding on how we can preserve our environment, especially in terms of air quality. All right, before I start with the presentation content, okay, I would like to promote this one, yeah. Okay, actually, the very first International Day of UN or United Nations Clean Air for Blue Skies was held on 7th September 2020. So early of this month, we have this International Day of Clean Air for Blue Skies, and this is aiming to raise public awareness at all levels and also to promote and facilitate solutions to improve air quality. So to those who has taken any initiative or activities, for example, you go for cycling or you do some tree planting, okay, please share your posting and then use this hashtag clean air for all, and also hashtag World Clean Air Day to get their attention. Okay, please do so. Yeah. All right. Okay. We may start now. Yeah, with some basic information on the air pollution and air quality. And according to WHO or World Health Organization, air pollution is considered a silent killer. Why? Because of according to WHO also, 7 million people died prematurely. Okay, due to this bad air or air pollution. So prematurely means that belum sampai masa dah gone. Okay. So this is considered as greatest killer because it is much bigger than malaria, violence, HIV or AIDS, drugs, and then apa lagi? Even traffic accidents. Okay. And if you can see there in the, I don't know whether I can use apa ni laser pointer here. Okay. Okay. If you can see here, okay, over 2 million. Okay, we are in the chart topper. Okay, over 2 million people in the Southeast Asia region are affected by the bad air or unsafe level of air pollution. So we are among of these statistic. It is very serious. Alright. Whereas in Malaysia, according to a few studies, okay, I would like to pick this one study done by Zainal Abidin in year 2014. That was around 6 years back. The study suggested that they have done surveys on 2,000 school children in Klang Valley, and they found out that more than 35% of the respondents or the school children showed the symptoms of having respiratory problem and asthma. And can you imagine how much the percentage of school children nowadays in 2020? Okay, and according to the Datuk Nur Hisham, Datuk Dr. Nur Hisham, our Ketua Pengarah Hospital Health, PG Health. During haze, there were increasing numbers of admission to the hospital due to pulmonary disease or respiratory disease, which is about 16%. So this is very serious problem. Okay. Oops. Right. Okay. Here are some of the topics or contents that I will cover. Okay. So inshallah throughout my presentation, I will be sharing the air quality status and its relationship with COVID-19 pandemic. We shall see what are the status before the COVID-19 pandemic, and then during the COVID pandemic, and as well as we from my insight and from UniMAP's insight, what would be the possibility of air quality in the future, okay, especially after COVID-19 pandemic is over. And then maybe I will share, if time permits, I will share inshallah some of tips on how we can contribute towards cleaner air and getting back our blue sky. Okay.
Dr. Sara, we cannot hear to you. Dr. Sara? Dr. Sara, we cannot hear to your voice.
Okay, all right. Okay. I think I'm this now. All right. Okay,
clear.
I'll continue. Okay. There are three main categories. Okay. The first one is the main air pollutants. So main air pollutants is the pollutants that are taken into consideration for human health effects or impacts. Yeah. So these pollutants consist of carbon monoxide, nitrogen dioxide, ozone, particles, including various sizes, PM2.5 and PM10, as well as sulfur dioxide. And then we have another category, which is called the greenhouse gases. So this greenhouse gases is the main contributor towards climate change and also global warming effects. Yeah. And then the last one is indoor air. So indoor air human rights, SDG, climate, environment, and economic. So for health, it is a very well-known link to cardiovascular and respiratory diseases, and it can also increase the risk for getting other non-communicable diseases. Okay, and then for human rights, like in India, in South Africa, okay, they are still using very old-fashioned types of burning stuff, and this can actually affect their health juga lah. And then SDG, okay, to promote SDG, they are in urge to actually to promote healthy cleaner air to the human world lah, okay. And then climate also, due to the greenhouse gases, it can also actually increase the earth temperature by up to 0.5 degrees C or degrees Celsius. This is very serious because of in USA, they have also declares that climate is one of the national threats to them. And then in environment, we know that air pollution can also affect environment and can also leads to other type of pollution such as water, solid waste, and so on and so forth. And then economic, also in terms of economic, air pollution can cost million or even trillion US dollars every year, especially in treating when affected patients. Yeah. All right, now, okay, pollution made COVID-19 worse. Okay, what actually before I go through the air quality during the COVID-19, okay, actually there are some report or scientists suggested that when persistent symptoms of air pollution towards patient has also increased the mortality rate of for the COVID-19 cases. So okay, right. Now let's see before the pre-COVID, I mean before the COVID-19 pandemic occurs or hit us. Okay, we can see that transportation is one of the highest contributors toward air pollution. And among of all the transportation, aviation is one of the most the most contributors lah, okay, in terms of climate change, and it may also release other types of air pollution such as long-lived gases like nitrous oxide. And this nitrous oxide can react with oxygen at certain altitudes and can also increase the ozone formation. And even so, it can also emit something that we call as condensation trails or contrails. Condensation trails ni macam ni lah, the flights, and then you see the white smoke coming out from as a result of the flights flying lah. So this is for the contrails. So the effect of contrails here can also be linked to the global warming. Yeah. All right. And we, as we also aware that million people kills Okay, there are 7 million people killed due to air pollution. Sorry, before even COVID-19 happened. Okay. All right. As COVID-19 happens, and then as countries went into lockdown, okay. And before that, the question now is there any link between COVID-19 and air pollution? Okay. Several studies suggested that there is significant impacts of air pollutants on intensifying numbers of COVID-19 affected persons or patients. And even a study from Harvard University investigates this and found out that an association of increased risk of COVID-19 death with long-term average exposure to fine particulates matter, especially PM2.5, happens, yeah. Even a small increase in concentration of PM2.5, which is 1 microgram per meter cube, will increase the fatality rate at about 8%. And this is very much affected the patients with living in the unsafe condition of air before COVID. Okay, and even in northern Italy, they also found out that this mortality rate even increasing up to 9%. Okay, and then meanwhile, several other studies also revealed that people who live in the most populated areas, such as in China, okay, in Wuhan, we know that Wuhan is the where the COVID begins. Okay, so the chances of getting or affecting is not affecting, is suffering from severe condition and eventually die from the coronavirus disease is increasing because of the level of unsafe air being breathing in. Okay, so as our countries, for example, in Malaysia, we went into lockdown. Okay, we were facing with 4 phases of MCO, movement control order, from mid-March until May. We have seen that most of the sectors that were impacted are road transport, and then industrial and manufacturing. Okay, and because of this, the global oil demand also becomes decline, okay, and drop. So that means what happens afterwards is the air pollution cleans the air. Okay, I mean air pollution hilang lah. Okay, and there were sharp declines in NOx, ozone, SOx, and particulates. Okay. All right. Okay. While the pollution inhaled in the past is still causing harm today, okay, the temporary experience of cleaner air was brought to us because of this lockdown or MCO. In Europe, we can see that the transport sector before this is the main contributor towards NOx emission, and also PM2.5 and PM10. And as we can see here in this graph, okay, we can conclude that all of this, if you can see here, the y-axis here, it means that the change during lockdown, so percentage of change. If it is positive, meaning that it increasing. If it is negative, it decreasing. So almost all of the pollutants here decrease, okay, during lockdown. Only ozone increase, having increment about 14 to 36%. Okay, this is why because of possibly the because ozone is the NOx is the precursor of ozone, so possibly because of there is drop in particulate matter, so the ratio of
ozone formation is getting increased, okay, because of because of the VOCs increasing due to activities happens during MCO, because all of us are being locked in our house. So we do many things that can create or emit VOCs. And VOCs, or volatile organic compounds, is actually one of the sources from household products. Okay. All right. Whereas in Malaysia, Umi, do I have more time, sir?
Yeah, you have another like 10 minutes. Yes, please. Yes.
Yeah. Okay, so whereas in Malaysia, yeah, okay, this one, this data or this graph I got from DOE, okay, DOE. So as we can see here, okay, among all of the cities, main cities in Malaysia, there were reduction of pollutants like NO2, okay, and then what else? PM 2.5, there are 17 to 36% reduction. And then in that one in Klang Valley, and then in main cities in Malaysia, like Penang, Shah Alam, Ipoh, Kuantan, Seremban, Melaka, Pasir Gudang, Kuching, and Kota Kinabalu, the reduction is also among the range. In between the range. Yeah? And then, I forgot to say this one. Even other particulates, other pollutants having very significant reduction. Okay, we can see that PM2.5 is having only small reduction here because of PM 2.5 sources came from a very complex source. Okay, it can be from not only vehicular exhaust but also from biomass burning, so from natural, for wind blown. So it is complex. So probably very low reduction in PM 2.5 also associated with the use of kalau in Europe, the use of heating equipments. And as for Malaysia, maybe because of electricity, and then kita punya the energy consumption also increasing. And also for sulfur dioxide and carbon monoxide are showing significant reduction. And then what will happen after COVID-19 goes away lah. So probably there will be two probabilities. Air quality will come back to normal, as we know, as we are feeling right now. Air quality is coming back to normal, and maybe it can be worsening because of improper waste management, just like what Dr. Tengku briefed just now, shared with us just now. Maybe because of improper waste management. Just now Dr. Tengku said that there are more than 100 non-sanitary landfill. Okay, so that means because of incineration, open burning, so probably air quality will be worsening. And then so what are the UniMAP's initiatives? Okay, in order to preserve the environment, especially to create ataupun to maintain cleaner air. Okay, we have declared that our university is as tobacco and smoke-free campus. Okay, so this is important. So for those of you contravenes with this, okay, you shall be fined up to 10,000 or 2 years imprisonment. Okay, so please do not smoke in our campus, and kalau boleh, if possible, stop smoking. It's not good for your health too, And then we have done tree planting through Dr. Umi. Dr. Umi has done some tree planting events, okay? And we also nowadays going for digitalization. So meaning that we use less paper. We use paperless methods of um, conveying information, okay, such as using emails and then using teleconference and so on and so forth. And then we also do some monitoring of air, okay. And I think we have actually doing much more than this lah, okay. And inshallah we will be improving this in the future, okay. So way forward, how can we actually maintain the clean air? Is actually the first one is I would suggest that it's possible eliminate activities contributing to bad air quality. For example, if when you go or you're going to work that you contribute to global warming, so don't go to work. But that is not possible, right? Okay, so you must go to work. However, what you can do is choose for better transportation. Okay, maybe you can sharing, okay, sharing transport, going choosing for public transport or cycling, okay, and then you can also practice energy saving, okay, opt for coaching, okay, including taking meetings and conferences online, just like what we are doing now. And then use public transportation, cycle or walk to get around. Okay, nowadays I know that people like to cycle. Okay, that's good. That also good for your health. And I really promote that. Okay, please go cycling. Go cycle. And then reduce your waste. You can opt for composting, recycling. Okay, because actually you can help by preventing the waste going into incineration, and air pollution is created later. Okay, so we don't want that. And then maybe we can also switch to a plant-based diet. Okay, dieting is good actually. Okay, cut single-use plastic products and consider ways of traveling to means that pollute less. Okay, as a conclusion, okay, I will conclude all my presentation today. Actually, I'm here to promote that, and then to get awareness that cleaner air is actually very vital to us, because 7 million premature deaths per year is not a it's not a it's very serious, okay? And 92% of work population are exposed to this unsafe level of air. And then during COVID, okay, air pollution brought twofold effects. The first one is it can exacerbate the risk of getting severe symptoms, and also it can also affect climate change. And then air pollution was likely worsening COVID-19's impact, and because of COVID-19, a blessing in disguise, it actually cleans the air and reducing some of the criteria pollutants. And maybe in future, I won't hope for this. Increased GHG due to energy demand will happen, and after lockdown, even much higher production of air quality due to improved waste management through disposable face masks and plastic going into incinerators will create more or serious air pollution in future. So in that, I will conclude my presentation, and I hope that every one of us can contribute toward preserving our environment, be it air, water, or solid. Okay, thank you very much. I shall reconnect back to Dr. Umi.
Right. Thank you so much, Dr. Sara, for your insight and for a very informative presentation. It's quite shocked to know that 7 million, yeah, Dr. Sara, of premature death
Yes.
caused by air pollution. Yeah, so it can, per se, it is a silent killer. Yeah, Dr. Sara?
Yes,
Right.
yeah, it's true.
True, yeah. So okay. So it's kind of it's kind of new things or shocking things that we know here, and we gathered it here. So what we can do, as a public, or if in UniMAP as a staff or students in UniMAP, to have this kind of awareness on waste management, on solid waste management and air quality
Dr. Umi,
management. Yes.
do you know how much breath that we take every single minute?
How much
Can
is
you
that?
guess how much breath? How much breath?
Based on
16,
air pollution. Yeah.
16 times, 16 times. So this is equivalent to 23,000 times per day.
I see.
Yeah.
So it is very, very essential for us to have a clean air, isn't it? Because we breathe that lot of air every single day. Am I right, Sarah? Okay, so I think we shall open to the attendees here for Q&A. But first, I will go to the chat section. Right, Dr. Tengku, are you on the line?
Yes, Dr. Umi.
Yes, Dr. Tengku. Yes, we have a question. I think from our students, from our alumni, Mr. Aki. What he said here, construction and demolition waste management system, or abbreviate as CWMS, a registration as letter from SW Corp on 29th of May. It says that it's compulsory for all construction site, to dispose their waste. Okay, can you comment on this, Dr. Tengku?
All right. Okay. So this is from Aki, from our alumni, I think.
Yeah, one of our alumni. Yes.
Hi, Aki. All right. Okay. So I think I cannot give firm answers for these questions, but I do believe this is due to the pandemics. As we know, as is mentioned, it is in May, so which is during the MCO, during the lockdown, whereas these construction activities cannot be conducted. So I think maybe this is a requirement for those industry that have I think they are the company that request to operate during this MCO. So I think that is my takes on this. Maybe only on the selected industries that request to have operation during the MCO. However, I suggest for Aki to directly contact the SW Corp for further confirmations.
Okay. So thank you, Dr. Tengku. We have a second question. Maybe we can directly ask Dr. Tengku. Do you have any idea how mathematician can jump into research related to solid waste? This is a question from Muhammad Fadli Ramli. I think he's doing his PhD. He's doing his research on solid waste management. Yeah.
All right. Okay.
So how mathematician can jump? Yeah.
All right. Okay. So thank you for the questions. Solid waste management is a very broad area actually. They have 6 major elements, which is on the waste generation, on-site handling, collection, transfer station, transport, processing, and finally disposal. So I believe there is a lot of chances for collaboration between us engineers or mathematicians and also the operators of the solid waste management. For example, as I present just now, is the prediction of the MSW versus the clinical waste. Probably we can come up with a new prediction or new modeling for household versus commercial waste, for example. I believe there is a lot of opportunities because it is a very broad area for solid waste management. I do also read in the chat section said that he also comment that this is a very broad area that can give a lot of opportunities. However, it is not a very popular areas, I would like to say, because when we say solid waste management, we relate to sampah, and once we say sampah, it is relate to bau busuk lah, right? So, however, if we are focusing on the management of the organic waste itself, of course, they memang dealing with this problem. However, there is also other branches. Mr. Fadil himself is on the routing. Okay, we can also go for LFG, which is the emissions on gas emissions. We can also ventures to the e-waste. As we know, e-waste do not produce any hazard, any odorous gases, and I believe there is a broad area if we try to have a collaboration on this.
In fact, Dr. Tengku, public always believe in numbers, am I right?
Yeah.
You know, say for example, what is the volume of solid waste produced each day, for example, that can, you know,
yes,
make
correct.
the environment,
when we say that per capita, we produce 1.1 kilogram per capita per day. It seems like a small amount, right? Everybody produce 1 kilo, but when we talking about the general, the mass generation is about 38,000 tons of waste were produced daily. So the numbers
imagine,
can give impacts. So I believe there is a lot of rooms for collaboration because we engineers and also practitioners kadang-kadang kita tak tahu how to do the modeling kan, the predictions. So this is where the can come in.
Yes. Okay, thank you, Dr. Tengku. So might be possible if any of the any of the attendees want to ask questions on solid waste management. Yes.
Assalamualaikum.
Waalaikumsalam warahmatullah. Yeah.
Can I respond on that?
Yes, please. Yes.
Okay. To me, solid waste management basically is a very big issue, and we do not know how much amount of waste that need to be collected. For example, no one knows how much waste that need to be collected for tomorrow, for next week, for next month. So, but we can, if we have a proper data, like our government nowadays try to make everything into the big data. So if we have proper data, so we can monitor what is the pattern. What is the pattern? So that's need mathematician or statistician to at least to forecast the right amount of waste. But we must realize one thing, because no one knows how exactly how much waste that need to be collected. So this is the major difficulty for the waste contractor and for the municipality council to plan and manage their resource. Because of this, it's hard to plan how much truck, how many workers, how many landfill that need to be set up. So this exactly rich in the research, but no one seems like interested. But I really hope, since there are many students here, hopefully there are a lot of students can pursue their study in this area.
Yeah, Dr. Tengku, is there any comment on that?
Oh yes, thank you for the comment. Okay, in terms of data, we do have some difficulties in solid waste management to gather all this data because previously it was not compulsory for them to do monitoring. Okay, but I think since 2010, okay, there is more data collection on solid waste management, and even the data itself have been published publicly. And if you are interested to read the report, you can purchase from SW Corps. They sell ebooks now. So usually they will give data for the last 5 years. So I think there is at least a start. Okay, a start in terms of data gathering. Okay, for the predictions, maybe I can give some inputs on that. According to JICA, okay, JICA studies, they have made a what we say bukan jangkaan, limit, okay, the production, okay, waste for 2020 for Malaysia only 30,000 ton. Okay, but we are producing around 38,000 ton. So it shows that we are not following this maybe something is happening, so that it shows that we produce more waste as compared to what has been studied by JICA. So definitely it is something need to be done. Okay, because solid waste management is not only on engineering or technical part, it is also a social economics studies as well. So everybody needs to take parts in reducing our solid waste production.
Yes. Yep. Okay, Dr. Tengku. So we give Dr. Tengku to rest a little while. We have a question from the Facebook for Dr. Sara actually on air management, air quality management. It's a very interesting question. Is coronavirus disease airborne transmitted? I think this is a quite So can you please give a comment on this?
Okay, actually I've been expecting this kind of question lah, because I think that most of us want to know whether COVID-19 can be transmitted airborne. Actually there are some studies and evidence suggested or showing that the possibility of transmission of this coronavirus disease through airborne. Okay, but however they are still under debate. Okay, due to methods of samplings and methods of conducting research lah. Okay, fortunately this is showing no evidence found in Wuhan. Okay, that can be related to airborne transmission in cases in Wuhan lah. And therefore, as our Dr. Noh Hisham has suggested, we must refer to the WHO guidelines lah and suggestions. So up to now, WHO continues to recommend droplet and also contact as the precautions, while airborne also could possibly be the route of transmission for COVID-19. So therefore they have suggested to advise us to wear face masks and then face shield for circumstances and settings when we are dealing with public. So I guess that I must advise others, all of us to adhere to the suggestions too. Okay, there might be possibilities, to me.
There might be possibilities, but still under debates, isn't it?
Yes.
Between researchers and things like that. Okay, I may open questions from the attendees to Dr. Sara, perhaps on air quality management. Any questions?
To me, I think I saw one from Aki Ikwan.
Aki, all right. Aki.
All
right. So Aki says that is it the interest in cycling rapidly increased during MCO? Okay, kayu geret ni kayu geret. Okay, maybe UniMAP can introduce. Betul Aki cycling to class, campus campaign, rather than using motor vehicles as a step to further reduce. Oh, this is a good idea. Okay, Dr. Sara,
Yes.
might be you have some comment on this.
Yes, insyaAllah. A good idea. Maybe Dr. Umi can also take up this one as one of Cosm punya project in future.
Yeah.
Maybe we can have a 1 day cycling day, okay? Or we can rent a bicycle or maybe you can just walk lah when nak pergi library ke, just walk lah. You don't have to use your car ke apa ke kan.
Yeah,
Right?
we have some initiative. We have actually two initiative, Dr. Sara, from the Chancellery, where they have these cycling activities, kayu gerek. So thank you, Aki. Thank you, Aki, for your suggestion. Right. Perhaps we will wait for some question. However, there is a question from the chat section for Dr. Tengku. Dr. Tengku still on the line. From Dr. Elmi Nahida stating that any remarks on the rural solid waste management issues, Dr. Tengku, any comments on this?
All right. Okay. So I think for federal, especially for federals that are following the SW Corps Act 672, 673. Okay. So there is not only on the waste management but also on the public cleansing. Okay. So these companies or these entities are the ones that do collect these waste which is under this act. All right, okay. So for these rural, what I can say for the rural solid waste management, I think if it is under SW Corp, I believe they are following the similar management as well in the cities. However, especially kalau ada dekat kampung-kampung atau kawasan-kawasan yang lebih pinggir, kadang-kadang they are not abide ataupun termasuk dalam kawasan SW Corp. Therefore, they always they don't have a schedule collection, solid waste collection. So usually what they did is they dumped the waste or they tanam the waste or even worse they bakar lah kan. Okay, so what we can do is this area maybe they can have a proper management by having appointed macam JKK kampung, right? JKK kampung, so that they can manage or they can have a proper management or disposal for their solid waste, because it is an issue kadang-kadang dekat kawasan-kawasan yang lebih pedalaman yang mana tak termasuk dalam kawasan collection for the schedule collection, so dia ada masalah untuk kutipan dan juga disposal of this type of waste. So usually what they did is dia tanam and also dia bakar lah, which contribute to another problems yang akan ada by Dr. Sara, which is the air pollution. So what we can do is they can have they can have their own proper solid waste disposal. Okay, by one way is they can have appointed entities to help them to collect. Even universities itself, macam university, macam UniMAP, SW Corp dia nak come in to the university to collect the waste. Okay, we appoint the swasta, private company to come and collect the waste and send them to the landfill. Once you send to the landfill, akan ada fees lah at the landfills for the handling of the waste.
Okay, even I think KPKT, isn't it? Kementerian Perumahan, still Kementerian Perumahan and Kerajaan Tempatan is dealing with this, isn't it? Especially in rural areas.
SW Corp is under the KPKT, under the JSJPN. So they are the one under KPKT as well. So we understand there is a few issues for the rural area, but I think there is some ways that you can do to help them.
Yep. All right. Okay, Dr. Tengku. Another one, last question ni, how to minimize the usage of plastic waste in online. I think this one is for shopping.
Alright, okay. I think the drastic action is tak payah shopping lah kan.
Cannot. That one
Yes,
cannot.
that will be the answer. Okay, we don't shopping, so we don't produce or we don't have additional or excessive waste from online shopping. But of course, tak boleh kan?
Impossible,
Okay,
yeah.
tak boleh. Okay, because that is the trend and that is the way we need to conduct one options to conduct the shoppings for the necessities. Alright, okay, what we can do is we can kita boleh ajar diri kita sendiri, okay, try to minimize, okay, online shopping, okay, and if we can try to buy in bulk, okay. So kalau you beli in bulk from the same store, they will deliver in one package, right?
Yeah.
So you tak payahlah kalau you nak beli, for example, you nak beli juga sekarang dalam kad nak beli sudu, garfu, pisau and so on. Okay, we did that online nowadays. If you can, we try to buy from the same store and request them to package in one big packaging. Okay, and after that we can eco brick. We reuse these boxes and so on. And I believe Amazon also have one options. Okay, Amazon they also have I'm not sure what they call it. I think it's called a frustration fee, something like that. Okay, where we ask them to do not ship our package in excessive packaging. Okay, sometimes you want to buy a very small bottle of paint, for example, but they pack in a very big box with all the bubble wraps and so on, and we can request that to reduce these excessive. Kadang-kadang dia punya packaging too much kan. So that I think there is a few options that we can do for online shopping.
Yes, even retailers are playing their part, especially using biodegradable punya packaging material.
Ya, betul. Kalau you all perasan, even the delivery foods kan, they're using boxes, they're using biodegradable materials for packaging. So I think it's also another good options to tackle this type of single-use plastic.
Okay, Dr. Tengku, thank you so much. Any question from the attendees here? Is there any questions?
Dr. Umi, I have one question regarding air quality.
Yeah. There is
the one from Zuhaili. Is there any correlation?
Is there any correlation between COVID-19 and the air quality? If yes, how to detect the presence of the virus? Okay, Dr. Sara, please.
Okay, actually I have mentioned this just now, Zuhaili. Yes, there are correlations between COVID-19 and the air quality due to, for example, before COVID-19 or pre-COVID-19, we know that most of the population of the world are affected by this air quality, unsafe level of air. So this can actually exacerbate the effects of COVID-19 patients, and showing the severe symptoms. Okay, and the second one is how to detect the presence of the virus. Okay, detection is a detection of what? Presence of the virus or the air pollutants? The virus, isn't it?
I think Zuhaili is trying to ask how to detect the presence of the COVID-19 in the air. Yeah.
Oh, in the air. Yeah. Okay. To answer this one, detection is actually pretty much costly lah for virus. Usually they use the biomonitoring sampling lah. Okay, that's all I can comment on this one because of this one must be done clinically lah. Okay, because it involving virus and
exactly.
Yeah.
Exactly, Dr. Sara. Exactly. So I think there is some question in Facebook. I think you can answer it later. But we are short of time. Maybe you can give some suggestion or some advice on air quality management to all the attendees here. Your last point, on your advice,
Okay,
perhaps.
just like I have mentioned in my presentation, okay, the thing that we can do is try to eliminate pollute our environments. Okay, try to save energies, and then carpooling, and choose for better options of transportation. Please avoid using flight if possible. Okay, if possible lah. If not possible, then you may have to use it anyway, right? Okay.
Malaysia lah.
Yeah.
Jalan-jalan Malaysia.
Yeah,
Okay.
nowadays we cannot go jalan-jalan overseas, so insyaAllah lah, the thing will get better because of this one lah. Maybe lah, yeah.
Exactly. Dr. Tengku.
And then, okay, yeah.
Okay, thank you, Dr. Sara. Dr. Tengku, your last remarks, perhaps.
All right. Okay. So we are living in an era that full of challenges, right? So this era, it is normal. It is needed for us to use face masks, use sanitizers, use gloves to protect us. But at the back seat, the increase of solid waste management, increase of solid waste production. So what I can say that we need to regularly or remind ourselves that we need to think that what happened after this era past. Takkan kita nak hidup dalam era yang perlu handle this single-use plastic which we already try to tackle pre-COVID era. So my suggestion is try to reduce these single-use plastics as much as possible. Dispose the face mask and gloves properly, and do not dump them into the river because it will cause another problems to the environment. I think according to this presentation for this evening, sharing session, I think that is what I can conclude.
Okay, thank you so much. But don't leave yet, okay, everybody. Because thank you so much for both of our panels. Dr. Tengku, Nuraiti, thank you. Dr. Sara, thank you so much.
Thank you.
Welcome, Dr. Mi. Thank you, everybody.
All right, thank you.
Thanks.
So overall, the information, suggestion and recommendation are highly dependent on awareness, betul awareness and engagement of the society, especially our staff and our students, Okay, so our team here in COSEM will continuously educate and spread the awareness through campaign and webinars, right? So before we end, I would like to ask everybody to on the camera, please. One time, so we will take one picture. We have 63 of you here. All right. Thank you so much, Aki. How are you? Aki, apa khabar? Thank you, Azira. Can you please open your camera? Bibiana, hello.
Aki, where's your face, Aki?
I can see it clearly. Okay, thank you so much. Everybody, please. Okay, we hope you are happy enough with our sharing today, so you can open your cameras. Our team will take the pictures. Abdul Hadi Haryani, please. Okay, thank you Sozi Cho. Right. Thank you, Dr. Miss Atika. All right. Thank you so much. So our team will take the pictures. Okay. 2 minutes. Okay. So along with that, we will have our third webinars, which we'll schedule within next 2 weeks. If possible. So I hope that everyone will join. Don't off your cameras yet because we are waiting for all to on your cameras. All right. At least we have half. Okay. So if you have any questions, we have FB Live in UniMAP FB Live. You can always drop a question there. Okay. Alright, do we have enough? Okay, I'm looking at the screen now. Okay, Zien, hello. Okay, don't left the meeting yet. On your camera before you left. Okay, so do we have enough? Right, okay. Okay lah. Okay, thank you so much to all. Okay, do something now. Apa? Sara, okay, love ke, some love ke, you know. Alright. Okay, some love here. So okay, our team will take your pictures. Thank you so much. So ingat hashtag kita apa? Bumi kita? Apa Aki? Bumi kita? Don't know. Okay,
Kita
our
yang
hashtag
jaga.
is yes, bumi kita, kitalah yang jaga, right? Thank you so much to all. We shall see in webinar number 3.